Okay, let's get our heads wrapped around this. We're in the 5th week of legislative session. We're about halfway done. We're about halfway finished with this short legislative session. Today is fiscal cutoff. Who can tell me what fiscal cutoff means?
Don't have the money, then go forward.
Pretty close. Pretty close. It means that if your bill might have a policy component, if it has a money component, it has to get out of its house of origin by today. Meaning it has to be kicked out of the fiscal committee and move on to the floor by today. It has to be kicked out of that fiscal committee by today. So what you're going to see today, for example, there's a House Appropriations Committee going on. If you've got time, swing by the O'Brien building and watch an Appropriations Committee. They're going to be talking about the fiscal impact of bills. There are some bills in that stack of legislation that's going to be reviewed today that you might be interested in. When you get there, take a look at the agenda and dive in. Today, those bills need to get out by COB today. Okay, let's just do a quick by the numbers. Just in the first 4 weeks of session, 1,200 bills. We go through all of them. You can take a look. Almost 90 bills in just the House Healthcare Committee. In the Senate, over 50. You can see which one's a little bit more active, and some of the politics about each chamber were discussed today. You can figure out why those numbers are the way they are. I'm moving through this pretty quickly. So you're going in to speak with a legislator. How many of you have actually met one-on-one with a legislator? Okay, so you've had meetings with legislators and one-on-one. Some of this stuff should be pretty obvious, but you'd be surprised. So let's go through it. You guys are respected. You're here because of who you are and your interest in the topics. So go in with that confidence. You know more about the work that you do than legislators do. Does that make sense? So talk to them from your area of expertise. Talk to them about what you know. That's what they're going to be interested in. Listen and ask questions. It's a normal conversation. As my mom says, they go to the bathroom just like you. She's a nurse, by the way. She's an ER nurse. So I think that example should make sense. Now, what to say? What to say? I made this up. You're a constituent. That's the letter C. You're a constituent. You need to state that when you walk in the room. That matters to them. Why? Any guesses? Because you vote. Because you vote. Exactly. Ask. You need to have an ask. When we go through the issues shortly, you'll see on our pages, on our one-pagers, you'll see a green box called the call to action. That is your ask. And we'll go through those for each of those issues momentarily. Be succinct. These folks don't have a lot of time. They want you to come in, they want to hear that you're a constituent, and they want you to jump into the issue with the ask. Does that make sense? Then talk to them. Have an exchange. But base it on your priority issues. Be succinct. Get those out of your mouth first. And be prepared. You will be meeting with your colleagues oftentimes. So if you can get to your meeting 5, 10, 15 minutes ahead of time, coordinate with who you're going in, who's going to say what and when. You don't want to be stumbling over one another. You want to make sure that you're coordinated and you have a single ask when you go in to speak with that elected official. Does that make sense? Okay, good. Can we get a thumbs up? Good, good. Suggest to meet after session in district. Sean just said when was the right time to meet with a legislator if you wanted them to do something this year, to drop a bill this year, last year, and the year before that. So you remember we're going into an election season. Set up an appointment. Express to the legislative assistant, express to the elected, hey, can we meet after session? I'm going to hook up with your office and let's have a sit down. I'd love to take you out to coffee. Does that make sense? Keep those relationships going. I'm so sorry for running through this so quickly. No, the clicker's not working. Okay. It did? Sweet. Okay. Here are the priorities. We've got 2 budget priorities that we're counting as a single issue. And then we've got 2 policy issues, again, with no fiscal component. Does that make sense? Okay, we'll talk about these. So everybody open up your folders. I want to see those folders out. I want to see those one-pagers out. Okay, let's jump into this. I won't spend too much time on this first one. This was a lobby priority for us in previous years. You know, the Affordable Care Act increased the reimbursement rate for Medicaid primary services for 2 years. That funding level was cut off in 2014, end of 2014. This year, we're asking for fair reimbursement rates. Our principle is access to care. So what is the specific ask? Can you guys pull up that Medicaid reimbursement chart? You see that green box? That's your ask. At a minimum, we are asking for $7.5 million for funding pediatric Medicaid primary care services. 7.5, pediatric Medicaid primary care services. There's a larger ask out there to bump up the rate overall for Medicaid primary care services. So why might we be asking for 7.5? Anybody have a guess? It's doable. It's doable. Thank you. So again, you're saying that 7.5 million Medicaid primary care. I'm moving through this one pretty quickly, but let's take a couple of questions on it.
Years ago, Medicaid primary care was bumped up for pediatrics. And then comes the ACA bumping them everything up to Medicare rate. So when that went away, what happened to pediatric? Did it go all the way back down, or did it go back down to status quo ante?
My impression is that the 2-year bump through the Affordable Care Act raised all rates for pediatric and adult up to Medicare rates, and then that bump as a condition of the Affordable Care Act bumped both of those sets back down.
Right, but are they at the same level?
Correct.
Or is the status quo?
Depends on the service. Depends a lot of time on the service.
Okay.
But what we're focusing on again is children's pediatric rate, 7.5 million. Does that make sense? Okay, let's move on to the next. Student loan repayment, again, building off of our success last year. Remember, this is a 2-year, we have 2-year legislative cycles. This is the second of 2. So we're building off of our success last year. Mental health student loan repayment. What you remember from last year was general health professional student loan repayment. And we got $9.6 million last year. Our ask this year, everybody look down at your green box, our ask this year is $3 million, one-time funding for health professional student loan repayment for those professionals who focus on mental health. Does that make sense? Why would we be doing student loan repayment? We treat it similar to the way we treat graduate medical education. We want to incent practitioners to stay in the location where they're doing their training. And a lot of times if we've got students who've got, physicians who have student loan debt, we want to help satisfy that debt so that they're able to stay in the communities in which they're training and working. Does that make sense? So we want to sustain funding for the student loan repayment and specifically a one-time $3 million increase for mental health professionals. Question.
Are these MSWs? Are they?
There's a long list. There's a long list of practitioners who qualify. It's not only MDs, DOs, MSWs, but we have PAs, ARNPs, et cetera, specifically with a focus on mental health. One more question back there.
Is there a bill number affiliated with this app?
No. So you'll notice, take a look at these one-pagers. These are budget items, so you will not have a bill number associated with it. On the Medicaid one, there was a bill that was heard. But please don't focus on the bill number. That was heard as more of a demonstration piece, an opportunity to talk about the issue with no intent on having that piece of legislation passed. I can go into more detail as to why that was used strategically, but again, we're focusing on the money alone, not the bill. There is no bill number associated with these money asks. Does that make sense?
And what's the condition for the student?
The condition is
Area?
there are several conditions. You have to stay for a certain amount of time. You have to do you have to do your work in the designated area of mental health. And again, those provisions are pretty well detailed, and this program has been in operation for several years. Actually, I think 10 plus years. Okay, let's move on to the stuff that's a little bit more dense. And again, I'd love to answer questions about this after we're finished. Okay, we had some good questions earlier about credentialing. How many of you have to be credentialed? This is a trick question in order to work where you're, okay. Fantastic, fantastic. So let's slow this down. Let's slow this down and walk it out. There is today, current state of the world, there is no deadline that an insurance carrier has to turn around your credentialing application. Now keep in mind, we're not talking about hospitals, we're not talking about facilities that have prearranged delegation credentialing arrangements. We're not talking about that. We're talking about the single physician who has to get credentialed through an insurance company. So we know today there is no deadline for turning that application back around. We've had some members tell us their delays in turnaround time are up to 8-9 months to get an application back. Meanwhile, you're sitting on your thumbs, unable to treat, not getting paid. Does that make sense? So here was our attempt. We wanted to, number one, put a timeline, put a time cap. Put a time cap in place. Give a time cap within which an insurance carrier has to turn your application back to you. And number two, the second component was actually a brainchild of Representative Eileen Cody and Dr. Funk. You spoke to this earlier. mandating the use of ProviderSource, an online credentialing portal run through ProviderSource. Now let's talk about the details. So what does the bill do? Take a look at the bill number. 10 points for who can tell me the sponsor of the House bill. Very good. Do we know who Representative Cody is?
Yes.
Okay, she's the chair of the House Healthcare Committee. Very good. Who's the sponsor of the bill in the Senate? Linda Parlett. Fantastic. On leadership on the Healthcare Committee. Here's what the bill does. It does two things. It puts in a time cap. It says, in the first 2 years from this point going forward, insurance carriers, you have to turn that application back around to us within 90 days. First 2 years, 90 days. Third year, average turnaround time, 60 days. So let's say that again. What does this do? It puts a time cap in, 90 days for the first 2 years. Third year, 60-day average. 60-day average. Second component, use of ProviderSource. Carriers will be on one side of that provider portal. Physicians on the other side of that provider portal. Now let's keep in mind, this bill is broadly drawn. This doesn't just impact MDs. This doesn't just impact DOs. We're talking PAs. We're talking ARNPs. We're talking chiropractors. So we've got a lot of support behind this bill, and this bill is agreed upon by the insurance industry and provider groups. So we're really excited about this piece of legislation, and I want to make sure this group is comfortable with the content of this bill before we move on.
You might make a question. I heard some disparaging comments about ProviderSource.
Correct.
Going on. You want to clarify that? Or make it feel
I
better?
do, and we've actually got Jeb Shepard, who's in the back, who's our lead on this piece of legislation, and we ran into that same sort of question, is ProviderSource going to be up and running? And Jeb, correct me if I'm wrong, but ProviderSource, the obligation to use ProviderSource wouldn't actually click in until halfway through 2018. Halfway through 2018. The idea being we need to give ProviderSource some time to ramp up. Dr. Funk.
ProviderSource has already had a couple of years to ramp up, and it doesn't work, and it distresses me the amount of effort that we've put into it and the lack of discussion or responsiveness from anywhere else.
Thank you for the comment. I appreciate it. No, we've heard concerns from both the provider community, the physician community, as well as the carriers. Carriers have also complained that the ProviderSource data portal has not worked as smoothly as they would have wanted to. Again, our goal is to make sure that there's enough time to ramp that up. So as we're moving into lobby day right now, when you go into a meeting with an elected official on this particular issue, we ask that you stay on message and we ask that you support the content of this piece of legislation. Last question on this. Oh, Sean?
I just want to add really quickly.
Sure.
Another reason is that delay was built in. We're all going to be working with carriers, providers, on making sure that that ProviderSource component works. There's a sufficient delay in there that if we're not comfortable with that, we can come back next year and revisit this and see, okay.
Yeah, that's a great point.
Maybe it can't be brought online that quickly.
That's a great point. Thank you. Did you guys hear Sean back there? We want to build in the delay to make sure that we've got time to fix it or pull out if it's not working correctly. One last question on this, and then we'll have plenty of time at the end. Dr. Chen.
Well, it's not a question, it's a statement that before ProviderSource, remember, we had to fill out separate forms for everyone. So it was a little clunky, is so much better than
Thank you.
sending in different forms for every adjustment.
Thank you. Thank you. So let's wrap this up again on this issue. Let's think about it together. First year, 90-day turnaround. Second year, 90-day turnaround. Third year, 60-day average. And last part, making sure that we're all using ProviderSource. Okay, so where is this bill? This bill is sitting in what's known as the Rules Committee, so its next step is to be voted on the floor. If your representative says, where is this bill? Tell me where this bill is. Representative, we need this bill pulled to the floor. It's sitting in Rules right now. It's sitting in the Rules Committee. We need it pulled to the floor.
Where is it in the Senate?
It's not moving in the Senate. We only have one vehicle. It's pretty common if there's an identical bill, if there's a companion bill in the opposite house, that the chambers usually have a discussion about who's going to run which bill.
So if we're meeting with our senator, what do we say?
Same thing. The bill is in the House, in Rules Committee, waiting to be pulled to the floor. Okay, this one's pretty simple, guys. This one's pretty simple. Who's the senator sponsor? Malosha. Malosha. That's how you say it. Senator Malosha. Who's the sponsor in the House? Orwell. Anybody have a meeting with Orwell? Fantastic. Fantastic. Let's make sure that we take some time to understand this bill, not too complicated. Obviously, why it matters, addressing the cost of care, health for our patients. Here's the point I want you to focus on. This bill raises the legal age of smoking to 21 for tobacco and vapor products. It's about that simple. I think it was spoken about earlier, actually. Attorney General Bob Ferguson, this is a priority for his office, and we're eager to support it. Now, what you might also get asked is, what about these e-cigarette vaping bills? Those are pretty complicated, and I'd be glad to talk to you about them after this discussion. But just for your additional information, and if you're a glutton for punishment, what we have on the back table near Shannon is a one-pager on e-cigarettes. And this one-pager is being used by the coalition of proponents on this particular legislation. Grab a sheet on the way out so that you've got it handy for your reference. Again, the 21 and older bill is spoken a lot of times in partnership with the e-cigarettes bill. Does that make sense? Okay, so let's recap, and then we'll open it up for questions. We've got 2 budget priorities: Medicaid funding, primary care, pediatrics, $7.5 million. You guys have that? Trick question. What's the funding amount for health professional student loan repayment? Mental health focus. $3 million one time. $3 million one time, meaning that cost is not going to be borne out in future cycles. You with me? Yep. What are our 2 policy issues? Credentialing, House Bill 2335. 90-day turnaround, 60-day average, and mandated use of provider source. And lastly, age 21. That's all you need to remember, age 21.